I'm Aidan Fowler, I'm the National Director of Patient Safety. A National Patient Safety Strategy is needed to set the direction in changing how we approach patient safety to go further than we've gone in reducing the levels of harm. We need to have a direction of travel. We need to understand what we are setting out to achieve, how we're going to measure that, how we're going to demonstrate the impact, and how we're going to influence patient safety across the system. What we want to do with the strategy is set the direction for the next 5 to 10 years in patient safety, and in doing that we want to see a sea change in the levels of harm. We want to change the system fundamentally from one where I think we've seen a lot of regulation and an approach that says we must pick out individuals sometimes, and we must blame people too much for what goes on in harm. And we're trying to say that actually the approach needs to change to understanding the system and the culture of safety fundamentally, and creating a just culture before we even look at the individual elements that we should work on. We felt that in going out to people, we definitely wanted to listen to people and take their views and go out and engage widely in getting views. And we could have done that in several ways. One was just to say, what should we do? But we felt it was better to go out with a discussion document and say, here are some areas we think we could work in. Here are some things we think we should be doing. Here are some ideas. Please feed back on them. And I think that's worked well for us because people have been incredibly engaged. We've had a lot of feedback around the concepts, and it's given them a starting point. So the strategy has been developed through consultation around a framework document that was relatively skeletal compared with what we see now. What we see now is actually a curation of other voices. So we've taken experts in the field and let them write their own sections rather than it being a top-down document where we tell people what we think they should do. So strategies for anyone who works in healthcare and anyone who experiences healthcare. So actually we've been very deliberate in involving patients and carers in the thinking around the strategy, moving into a world where they are much more engaged. And I think we can do better with that engagement. So it's arguably for everybody, but the expectation is that it's something that should impact on the lives of all healthcare workers and improve care for patients. The strategy has some enabling principles. So in it we think about safety culture, safety systems, just culture as underlying approaches. And then we divide the work into 3 areas. And that's described as insights, involvement, and improvement. So in the insights section, we look at how we learn from the system and how we monitor it. So how do we use data better to understand what's going both wrong in the system, but importantly, what works in the system. And that's one of the shifts, is to thinking more about what's good and not just what's bad. And we talk about how we will change the way we understand what's going on in the system and make better use of data we get. In the involvement section, we talk about involvement of patients, and we talk about training, and we talk about developing specialists in safety. So offering training at a number of levels for staff and for patients and their representatives. Organisations often have a safety lead, but not universally, and they're very different breed across the system, and there isn't a sort of high level of training that they specifically receive. And if they have had patient safety training, it's often very generic, and there's nothing wrong with that, so they understand the basics of safety, but they're not necessarily inducted and trained in our system and how we use data and how we approach alerts and other important safety issues. So we want to develop training in that. In the improvement section, we want to think carefully about how we use the resource we have to improve the system. And I think we're moving from understanding that we have a multitude of safety concerns to approach, and thinking more of deliberately working in specific areas where we believe we can have the most impact, rather than trying to keep all the plates spinning of working in all the areas that we possibly could. So in thinking about where we do improvement, we need to understand what's the potential for impact. Is there an implementable solution to the problem? Is there something we can test, or is there something we can roll out nationally? And if there's a gap in our knowledge of how we improve safety, we should be going out and commissioning research to help us understand how to fix the problem.